or define or treat trauma or treat depression. So I just want to say that out loud, that there's some misguided efforts to address this kind of thing that can do more harm than good. That's why you don't want to walk out this door and go, I'm giving everybody the ACEs questionnaire and then I'm going to treat them for it. No, let's just go ahead and teach everybody emotional regulation. And if you want to do ACEs test, then do that, but be prepared to treat that or refer out and know your referral sources. Yes?
Sorry.
Oh, no, you're good. I get some exercise.
Related to that, in one of the groups here, just recently, a client said that they talked about the ACEs study in in a prison, and she came away from it angry because the way it was presented was, well, you know, you were set up for this, and that's why I think your comment about the resources.
Yeah, how'd you survive it?
So important.
Yeah. All right. John, we can hear noise coming from you guys' direction. Somebody talking, just to give you a heads up. Okay. I don't know if someone's coming through and asking questions, but we can hear them. Just give you that heads up.
You can hear someone from the computer?
Yeah, there's a voice coming out from over there that is someone talking.
It's a female voice.
It's a female voice, yeah.
That was just, I turned it off. It only happened for like a second.
Oh, yeah. Just letting you know. I didn't know if someone was chiming in. All right. Yeah, so, you know, the best thing about these trainings is when we come together like this and talk, we have so much experience in this room to share and to understand how trauma affects in so many different ways, so many different populations that that you can't get on a regular just online training or where you're not around people who are doing this in-depth work. All right, back to the PowerPoint. I don't think he knows that, I don't know what we're hearing, but it's doing it again. Just to give you a heads up, we heard it again. It's not bothersome, I just didn't know that if you knew that was happening. All right, moving on. So ACEs, the conceptual framework is it falls like this. A person has an adverse childhood experience and or traumatic or a negative event that leads to disrupting their neurodevelopment, their neuro and social development. And then, well, that goes up to social, but their neurodevelopment, how their brain and body develops. Then that flows up to social, emotional, and cognitive impairment. Then adoption of health risk behaviors, and then on up to disease, disability, and social problems, and that leads up to a 20-year difference in mortality. In other words, a person's more likely to die 20 years earlier than they would have. So question 7, the adverse childhood experience study showed that A, ACEs can lead to chronic health problems in children and adults. B, higher ACEs scores can lead to suicide. C, the ACEs affects health across a lifetime. D, a 20-year difference in mortality. The individual may die 20 years earlier. Or E, all of the above. All of the above. So we're going to learn another skill. This skill, I first learned it from the community resiliency model. It's used by other models as well as an emotional regulation. So the first thing to do when someone is activated or upset or really struggling is to use supportive phrases like, you're not alone, I'm here for you, I can help you, let's see what we can do to help you get grounded and get through this. And one of the techniques is what that guy's doing there is pushing against a wall. Another one is, which is down here, pushing against a wall. So here's a question we can ask. Would you be willing to see if we can walk or push against a wall to help you? Let's do it together. Let's give it a try. And I like to say, it may sound crazy, but just getting up and walking or pushing it against the wall can really help shift your energy and your thoughts. Let's do it together. Let's give it a try. I'm here for you. You're not alone. Begin with walking and tapping their legs, then move to pushing against a wall. So I've had the pleasure of being in our psychiatric unit, and one of the things that we do when people are pacing is to first connect with them. Hi, my name is Linda, and I'm a social worker, and I'm here for you. And if you're open to it, I'd like to walk with you and show you a couple things that can help ground or calm you or help you work through the thoughts or feelings that are coming up now. Would you be open to it? And if they say yes, then I'll say, well, let's just walk. Let's just do a couple of circles here around the nurse's station. And if you're open to it, the leg that comes in front of you, just tap it. That bilateral tapping and walking and breathing can really be helpful. And so I have them start with a deep breath in the nose, out through pursed lips, and let's just walk and tap. You can also have them walk and tap alternately, their upper arms. And again, saying, you know, you've been through a lot, and I'm here for you. I'm open to supporting you. Tell me what's happened to upset you right now. And so again, just making that verbal connection and teaching the skills of bilateral tapping. Then you've got pushing against the wall. After they talk and they begin to wind down a little bit, you might say, if you're open to it, it could be helpful, as crazy as it sounds, to push against the wall. Are you willing to give it a try? And they're like, fork, yeah. And so you have them put their hands, y'all gonna go home and watch that, right? That's a great series. The way she whips it out is really good with the fork and shirt, and she's got several others, right? So they put their hands against the wall. I coach them to notice your hands against the wall. Is it warm or cool? And they might say, well, it feels a little cool. Is it rough or smooth? Which, again, gets their attention off of the triggering thoughts and onto the present moment and what they're experiencing. So they may say, well, it's kind of rough, or they can say smooth, whatever they're experiencing. And so I have them take a step back with their feet so that they can put a little bit of their pressure of their arms and body against the wall. And then just drop a foot forward, bend that knee, and begin pushing. And really noticing if they're breathing or not, because sometimes they'll hold their breath. So I'm going to have them take a deep breath and just really push and feel that in their hands. Tell me when you can feel that in your hands and arms. Yeah, I feel it in my hands and arms. Another deep breath. Can you feel that in your shoulders? Yeah, I feel it in my shoulders. If you want to switch feet, you can bring another one forward, bend your knee, press into the wall. Feel that in your shoulders and back and legs. And so let's just push against the wall until you get tired or you feel like that you're ready to stop. And they'll usually do it for a minute to 2 minutes, not very long, because it is tiring. It's a static exercise. But it's really helpful in giving them something to push against, something to experience their container being back in their body. So pushing against the wall and bilateral tapping are both there in your handout. And the language is there to help you teach it or share it. I encourage you to make copies of that handout. If you get a bad copy or something, you need an electronic copy so you can make clean copies. If you email me, I'll send you my copy. Yes, Margie?
That resources list on your website?
No, I should. That's a great idea. And then everybody can access it instead of emailing me. And yes, great idea. Yay! Create that on my website. Yes, I still will. Yeah. All right. And I do have my business cards up here if anybody wants to stay in touch, and it has my website and an email and that kind of thing on it. Because you may get home and dig up some research and go, oh boy, Linda was wrong. Let me let her know, because I want to know if the research has shifted or changed on anything. All right. So brain gym, look at these cute kids. So we've not covered a lot on children today, but educational kinesiology or brain gym may help children with developmental delays due to trauma. They cover how stress, trauma, and chaos affect the brain, how compensation patterns or coping behaviors become habitual, repetitive actions strengthen neural pathways, both good and bad, covers early trauma, can interrupt the orderly progression of reflexes. Like one thing that my chiropractor told me is make sure your boys both crawl, because there's all kinds of toys or props like walkers, baby walkers, and baby jumpers that you hang in the doorway and all that. It prevents them from getting on the floor and doing bilateral crawling, which develops the lower back arch and bilateral stimulation development of the brain. So boy, we use some of those tools, but we got them in the floor. They are only allowed to be in for a short period of time. and get on the floor and do that crawling. Because if you remember, the first thing that happens is combat crawl, and then they push up and crawl on all fours. And a lot of people are trying to sit babies up too fast, put bolsters, or you can buy those, they're plastic and soft. They're like a gym kind of padding, but that you can set your baby up and force their baby to sit before they're ready. Can you imagine what that does to their back? My chiropractor said it's horrendous. You are setting your child up for having back problems for the rest of their lives because they don't develop the necessary arches or the right-left movement by being forced to be put into those things. So somebody needs to go ahead and sue those people, I think, for damaging people's backs, because everybody wants their kid to be able to sit up and be able to play with things, but they're not made for that. They need movement, not sitting. And now we know that sitting is the new smoking. We're all dying from it, right? Well, it's true. I mean, you know, we were talking at lunch, I'm going to take a 9-hour airplane flight in April, and I'm really worried about sitting for that long because I've been sitting since 1980. You know, I'm 61 now, and I started sitting when I got out of college doing social work and therapy. And so here I am now with lots of back problems because of that. So we need to be careful with what we do with our children. So this is like a 2-minute video. Let's see if I can find it real quick. I'm wanting to show all the ones that I didn't pull up earlier. Let's see. Because it's so cute, and it will remind you of what children, how they benefit from the pretzel and other things. So remember, the pretzel came from Brain Gym. Oh, wait a minute. I know why I couldn't find it. I think it's gone, but let's look at Brain Gym. We'll just do that and see if I can find it real quick. Oh, there it is. Yay. So there's actually Brain Gym for adults, as you can see at the top. There's all kinds of sing-along and movements and just lots of, there's some Brain Gym out of India where they're doing finger movements, some yogic finger stuff. What?
Are they doing mudras?
No, no, it's just finger exercises and focus. But yeah, mudras, that's a whole nother ball, yeah. Oh, once again. Tell you what, if we did more of this kind of stuff on psych units, we need a lot less medication, I think. All right. What jumped out at you there? Other than the cutest kids ever. Nothing? Yes?
What jumped out at me is if you talk about putting children in the sitting position before they're ready,
Yeah.
how many more problems are going to be seen down the road from kids who are in screen time
Yes.
as infants?
Screen time as infants.
As
Yes.
opposed to doing what they need to do.
Yeah. As opposed to doing movements that they need to do. Yeah. Woof. Well, I was going to tell us.
Analog brain developed.
Yeah. All right. So we're going to do EFT. How many of y'all are trained in EFT? Or all right. So I'm offering a training in EFT. I think it's this month out in Leicester. So I think it's like the 22nd or somewhere around that. But it's we're going to teach just 2 points of EFT. They're the universal points. The first is the karate chop point, which is if you were to karate chop a table, that's the 2 points, the fatty part of your hand there. So you just tap those together and you repeat the phrase, with all my problems. Say, with all my problems. And all my limitations, I deeply and completely accept myself. And we're going to do a round of 3. With all my problems and with all my limitations, I deeply and completely accept myself. With all my problems and all my limitations, I deeply and completely accept myself. All right. So if you knew a person just was wigging out over their father passing away, even though my father passed away and I miss him deeply, I deeply and completely accept myself. Even though my father or my dog or whatever passed away, I deeply and completely, and I'm grieving and I really miss him, I deeply and completely accept myself. So at the hospital we use it, even though they're holding my lunch and I can't get lunch until I have my gallbladder x-rayed, I deeply and completely accept myself. Even though I want to kill someone because I am very hangry waiting on my gallbladder to be. So, you know, we just tap the shirt out of it. All right, up here we're going to the collarbone. This is not quite accurate. We want to go about midway up the collarbone, underneath in the soft tissue there. And we're going to, it's hard for me to tap because I got this microphone, but you want to just massage it or tap it, and we'll say the same 3 things. So find your collarbone and then go halfway up it or down it and then drop under. There you go, you got it. So under the collarbone. And we're going to say, with all my problems, go ahead, with all my problems and all my limitations, I deeply and completely accept myself. With all my problems and all my limitations, I deeply and completely accept myself. With all my problems and all my limitations, I deeply and completely accept myself. Very good. All right. So that's the EFT, and it's on your handout. So do not walk out of here and say, I can't believe she didn't get... It's in front of you. Everything that's important for you to take today in the way of skills is in front of you on your sheet. And feel free to change that. You can cut and paste only 2 or 3 skills that you hand out. You don't have to give that whole thing to a patient. You pick and choose what you seem to works best. Question number 10, trauma-informed care. A, aims to avoid re-victimization while supporting patient to self-soothe. B, appreciates many problem behaviors, began as understandable attempts to cope, have now become dysfunctional. C, trauma-informed care strives to maximize choices for the survivor and control over the healing process by bringing the brain back online. D, trauma-informed care seeks to be culturally competent. And E, it understands each survivor in the context of life experiences and cultural background. Or E, all of the above. F. Fork. All right. How many of y'all have heard of mirror neurons? They're right behind your ears. Mirror neurons is when I walk into a funeral home and I look at all the sad faces and crying people, I go, oh, my mirror neurons are picking up what's going on. If I'm walking into, let's say, a surprise birthday party, and we're all getting ready for the person to drive up the driveway, we're all excited. My mirror neurons are reading everybody's excitement. So mirror neurons help us read social cues. They help us to feel connected. They help support healthy attachment. So mirror neurons are located just above and behind the ears and brain, may explain why we mimic other people's behaviors to empathize. How does this apply to healthcare staff with patients, or how does this apply to us as counselors? I saw a counselor the other day. Where was I at? I don't even know where I was. Anyway, it was a counseling situation. Oh, I was supervising somebody somewhere. And they went in and they were asking questions, doing an assessment. And the client was in an upbeat place and sharing. And the counselor went like this. Oh, that's so awful. And you're like, wow, they just judged what the client or patient was sharing as awful and scrunched up their face when the client did not think it was awful and was simply sharing it. So what happened? What happens? What's the danger in that? Implanting, I think it's bad, you should think it's bad. It really is bad and you're wrong. There's just lots of implications there. So as counselors, it's not that we shouldn't be empathic, but take the lead of the client. We don't want to jump the gun, awfulize something that's not awful to the client. I right away was like, I jolted. It shocked me so much for her to assume right away that what that client was sharing was an awful thing. And just the affect, I think, is what really affected me the most. I'm like, whoa, that's about you, baby. And I didn't say it, though, but we talked about it. I said, so, well, I noticed that when she said this, you said I was awful, and you kind of scrunched your face up like it was really bad. What was coming up for you? And she said, well, it was bad. And I said, for you or the client? And she said, well, the client should realize that was really bad. And I said, should. It may not be what needs to happen here. So we processed it. But again, really watching how we react to clients. Let's see if I can remember Sharon Wise's story real quick. This is a good one. So if you're activated, they will mirror you. If you're calm, centered, and grounded, they're most likely to begin calming. So emotional regulation benefits the whole environment. If you're agitated, let's say if you've got a private practice and something happens over lunch, you're upset, you come back and you're dysregulated, how effective are you going to be with that 1 o'clock client? Yeah, not as much. So it's really important. Sharon Wise was an African-American woman who came and spoke at Mission. She was awesome. She talks about what turned her life around. She was in a psychiatric unit so much that they called each other by first names. The staff and she. Even one of the physicians, I think she said, she called by the first name. Anyway, she said, and I was in there for the 39th time or something, and it was a lot of times, and she said, they trusted me so much that I knew the way around, that they were short-staffed, they were stressed out to the max, and she went, oh my gosh, they're more stressed out than me, and she's the patient. They said, here, Sharon, you've been here a lot, take these handouts, stand here at the door, don't walk out, you know it's a lockdown unit. People are going to be coming through that door, give them a handout and show them the conference room. Can you believe that? Yeah, that can happen. She said at that moment, she realized she was worth something, that they could trust her, that they gave her a job. That was the last time she went to that unit because she had a purpose and personal value. And she said that event, as egregious as it sounds to most professionals, was the crowning moment where my life changed. I had purpose, meaning, and belonging, and they gave it to me. And she went on to become like, Tony Arcane in the video Healing Need, she became like one of the leaders of the national movement for trauma-informed care. So if you look up Sharon Wise, I haven't seen if she's gotten any videos up yet, but she was a very powerful speaker. And she was quite interested. She only knew about EMDR. She didn't know about all the other therapies. And as I was talking with her about them, she was amazed that there were other therapies out there and was very glad of that. So moving on to resiliency, and then about 10 minutes we'll take a break. Resiliency is the capability of individuals to cope successfully in the face of significant change, adversity, and risk. The capacity changes over time and is enhanced by protective factors in the individual environment. And many of you know that Mission was purchased by HCA, and some staff were handling that well and others not. Again, the difference in how people react and how they struggle. And I would also say that many of the people who are able to navigate that shift in policy and differences in the hospital were those who were the most resilient and probably had the least amount of trauma. So one of my goals is when people talk too very negative about Mission and the transition, I'll go, I'm an employee and I'm still there, and I'm going to show up and do my best. And when I can't, I'll leave. So we each kind of have to take responsibility and be as resilient as possible, but also stand up for and support other people to be resilient and to work through their difficulties. Number 8, resiliency measures a person's ability to experience traumatic events or chronic stress and be able to navigate them, as well as have more physical and emotional stability. True or false? True. All right. Trauma, y'all get a certificate at the end of the day if you make 100. Trauma-informed, and I'm part of that. Make sure that that happens. Trauma-informed care creates environments that increase resiliency, such as a reliable support system. Many of the nurses will talk about it towards the end of their 12-hour shift on their 3rd day, that sometimes they kind of want to melt down and have emotional regulation issues when difficult clients come in, or the 5th alcoholic comes in and is swinging at nurses and being difficult. They may say, can you take that client, can you take that call to that, they're ringing their bell for the 50,000th time, would you be willing to take that call while I step into the bathroom and pretzel up? And here's the pager. And they do that for one another because now they have the resiliency skills to get through that chronic stress and that difficult client. So trauma-informed staff that provide trauma-informed medical and mental health care. So this is where we're really looking at the shift in your agency, the shift in the environment. Tell me your first name, it flew out of my head. Jennifer, yes. Jennifer was talking about in our schools now we're doing these shooting drills, live shooting drills, and how traumatizing that is for many children and individuals that already have trauma. And she was asking, how do we impact that? And I suggest you write the Board of Education, you call the Board of Education. If you write a letter, copy the State Board of Education in Raleigh and start having a voice, because you have the right to have a voice. And years ago, at October Road, we had a problem where Western Highlands would not pay for substance abuse intensive outpatient after individuals came out of ADAC, the Alcohol Drug Abuse Treatment Center, because they may have burned through their units before they went to ADAC. So you had to go into SAIOP, substance abuse intensive outpatient, for 90 days and fail before you went inpatient. That was the rule. But then when you went inpatient, if you burned through your units when you got out, you couldn't come back to SAIOP, which was the recommendation by the state as a step down. So being in my ignorance and wisdom, I thought, well, that's forked up, and contacted our rep at Western Highlands. And they said, Linda, we weren't even aware of that issue. Would you be willing to bring it to the next provider meeting? And I was like, okay. Went to the provider meeting and spoke about it, and they changed it immediately. They had no idea. So sometimes the higher ups are so busy doing what they're doing, they don't know what's happening where the tire meets the road, right? So I challenge you to write that letter. Let me know when you do it. Anybody else that's willing to join Jennifer in writing that letter. I've had plenty of supervisees talk about AB Tech and the other community colleges doing those same shooter skills and being mortified. So keep in mind that you have a voice, you can change the world, go get them. All right. So, and that addresses this environment. If our school system is harming our children because we're not passing gun control laws, we need to speak up and vote when it comes time next fall. Access to safe, stable housing, food, and water. This is the #1 reason why mentally ill people are coming into the emergency room at Mission. Yet Mission wants to complain about the cost. But Mission teamed with VIA and RHA to create mobile crisis, as well as what's the 3C? C or C3 356. Love that name. As a place to go that's an intermediary, so they don't have to go. They can go stabilize at a peer living room at Sunrise or at C3 356 crisis before they get to the emergency room, which is flooded. And then we lost our IPRS funding, but that's a whole other topic. All right, moving on. Timely and appropriate care from first responders and EMS. And one of the things Mission has done very well is hire me to train EMS and first responders in trauma-informed care. And I'm starting to get, we're not done yet by any means, but going from Asheville all the way to Murphy to train those people. And when they learn this, and I'm also teaching them motivational interviewing, how to motivate people for change, they're like, wow, this is incredible. For the first time, they feel like they've got something to prevent the next incident, as opposed to being helpless, just scooping people up, tying them to the gurney, getting them in, getting them shot with Thorazine or the B-52, and getting them, and then them sleeping it off. So creating a resilient environment. So you saw the cross crawl in the picture, you know, the crosswalk and the cross stair. It's just elbow to knee or hand to the back of your feet. So that's brain gym again, anything that crosses midline. You will get on YouTube tonight, not YouTube, but Google, and you will find research that counters brain gym. I can tell you, I've been working with brain gym for probably 30 years, and I see children change and come to midline who could not catch a ball. So that research really pushes me the wrong way. And, you know, you can create research to support your cause or not. The proof in the pudding is, am I willing to utilize it myself and prove to myself it works? Am I willing to utilize it with families and adults and get permission from adults to utilize it with children and see if it helps? If it doesn't, stop. If it helps, very little harm is done. For years, we talked about not doing trauma treatment when people were in treatment for substance abuse because, oh, it'll traumatize them and they'll go back out and use. We now know the opposite is true, that if we don't treat their trauma, they're going back out to use. So do you see how time and research can change things? So really, be careful what you read, keep digging, and then utilize it yourself. I believe this is on your handout. Maybe? Yes, good. I think I gave you all the long. All right, so resourcing. All right, so close your eyes if you're comfortable. If not, look down and soften your gaze. We may have to do Bastrika after this because it'll knock you out. But I want you to, we're going to resource you. I want you to go back to a pleasant or meaningful memory over the last few days, weeks, or months. Could be with friends or family, could be with a pet, could be one of those days we had a few snow flurries, could be Christmas when it was 65 and the kids got to go outside and ride their bicycles. Could be something especially meaningful that you've seen recently, like Maya Angelou's talk with Oprah. I might show that at the end as a way to close. So pull up a pleasant memory. Take a deep breath when you have that pleasant, meaningful memory. And raise a right or left hand so I'll know kind of where everybody's at when you have that memory. Excellent. We'll give folks another few seconds to come up with something pleasant. And you can rest your hand down when you have raised it. And just sensing into that memory, breathing into it, creating some space inside to enhance that wonderful memory. And just notice for a moment what makes that memory meaningful or special. Notice who was there, or if you were alone or with a pet. Notice what time of day it was. Was it morning or afternoon or night? Were you outdoors or indoors? Was the sun out if you were outside, or was it a cloudy day? Notice if the day was warm or cool or a brisk cold. Notice any smells in the air if you were indoors or out. Sense into that memory again, experiencing what made it so special or meaningful. Make room and space for that inside as you breathe deeply. And notice where that memory lives inside. Notice if that memory lives in your head, or chest, arms, belly, or legs. Notice what that sensation is where that memory lives inside, if it's open or warm, or soft or airy. Enhance that sensation where the memory lives, creating even more strength of that memory. Embrace it, relish it. Breathe into that memory. Even giving that memory a name to anchor it, to strengthen it with one or two words that really capture that memory. One or two words that you can remember to always bring you back to this resourced memory. And notice your breath. Notice if your breath is fast or slow, shallow or deep, as you reflect on that memory. And giving gratitude and thanks for that memory and that event and everyone involved in it. When you're ready, begin to slowly open your eyes and return to this room. So that's resourcing a pleasant memory. That's anchoring it, strengthening it, enhancing it, really allowing yourself to go and be in that memory. Now, if someone starts crying and jerking and jumping, you might check in with them, see if they've shifted to a negative memory. But what was that like for everyone? What stands out in that exercise for you? Did you go there? Were you able to drop into it? Shake your head yes. Paw your right foot for yes. Shake your head no. Heck no.
No, I think you're able to make something that was very small and maybe inconsequential, something that is like a profound memory that you could come back to and draw strength from, something that would normally just be forgotten. Yeah.
Something normally be forgotten now is enhanced in a part of my being. Give her a certificate, she can go now. Anybody else? What was your experience? Well said, thank you for that. Yeah, things we forget can be become very powerful somatic memories that heals the what? The DNA. the soft protein coating on our DNA. You guys just healed some of your DNA by doing that exercise. Yes, Margie.
Already. I guess what came up for me is years ago when I was still in the process of like doing a lot of the deeper work of my healing, I did a visualization like this, but when I closed my eyes, it was not a good thing. And I couldn't come up with anything safe, and I couldn't only come up with scary things. So I have to remind myself frequently to really spend some time to get to know and build that trust and rapport before I start doing these kinds of things with folks, because it's kind of, you're not sure, you don't know kind of where they've been.
So important to remember that you want to check in with them to ask them what their resource is. What's your positive memory? Tell me a little bit about it first. And then if it's safe for them to do that, they can drop in. And here we wouldn't have been able to do that, so I just sent you guys off to your pleasant memories. When it comes to resourcing, make sure you know what the memory is, ask them a little bit about it. And as they talk about it, they'll start working their way into that memory. And then you can invite them to close their eyes or look down and soften their gaze. And I want you to really go into that memory. Allow yourself to, again, be there snuggling with the dogs. Tell me when you can feel their warmth. I can feel his little head laying on my shoulder. And breathe into that and strengthen that and offer thanks or gratitude for that little head on your shoulders. I just got resource, so that was mine. It was rescue love. That was the 2 words I put with it, because I have 6 rescues in the bed with me at one time, not including my husband. I didn't have to rescue him. I think he rescued me. So that's resourcing again. You've got that on your handout. You can read that to them. You can give, the better you get at that. Tell me your first name. Yes. Chris. Chris can tell you if he's trained in, not if, he is trained in transpersonal hypnotherapy. The more you do this and the more soothing your voice and the more powerful the words, you can even Google powerful hypnosis language or words, and they'll give you great phrases to really assist people in imaging and dropping in, breathing into that, noticing that, noticing where you feel that inside, breathing into that, creating space and opening for that. If the other thing you'll learn in community resiliency model and trauma resiliency model, if they say, when I think about lying in the bed with my dogs in the morning and feeling their warmth and hearing them breathe and it's quiet, I just feel this warmth in my chest. And they'll rub their chest, and you can say, I'm wondering if you're open to it, just slow that down, really enhance that movement, and really be in that warmth. And so that their movement, we can have them slow that down and enhance it. So that's another thing that if they start resourcing and say, when I saw that, I just felt so hopeful. And so you might say, slow that hand movement down and really breathe into that. Notice that hope that you felt in that moment. Do you kind of hear and see that? That would get into sensory psychomotor, that what's biological is psychological and what's psychological is biological. Is those gestures, those movements are a way the body's expressing those thoughts and feelings that are positive that can resource them and make them more resilient. So when you work on that trauma, they're feeling safer and they have a container. There's, I don't think I have them with me, but at Mission, we got a grant and we printed out these cards with 5 emotional regulation skills on them, the first 5 that you've learned today. And on the back of the card is this sunflower. So they've got a focal point. So what we can do is say, I've got a card I want to share with you of 5 emotional regulations, exercises or skills. I'd like to teach you a couple. And then I'd like to resource you to this sunflower. So when you look at this sunflower, any memories come up. Yes, sunshine and warmth at the beach. Or my grandmother grew sunflowers. Everybody's grandma grew sunflowers, it seems like. And so tell me about that sunflower, about that memory, if it's positive. So you can use visual images to help resource. Some of the nurses on our Capstone unit carry pictures they cut out of magazines of puppies and swimming and a kid swinging on a rope swing going to the water, and they laminated them and they have them in their pocket. And so they pull those out and will resource clients or patients by asking them to look at those pictures and tell me about one of those that brings a positive memory. So having lots of tangible things that can assist a client when they're going, I can't take this anymore, I've got to get out of here, and you go, I'm with you, you're not alone, would you be willing to walk with me? And you just match the intervention, the skill you've got with the level of activation. I've not introduced that as a concept yet, but it's really important not to say, just calm down. There's nobody here that's going to hurt you. I actually saw that happen the other day. And she had a ponytail this long in the back. I walked away and went, she's gonna die. She is gonna die. And I can't touch it. Because she's not in my discipline. Medical and social doesn't always cross where you work. And so then I went around the corner and there was a guy there and he had long hair down to his waist. And I went, you're gonna die too. What happened to supervisors saying, we don't wear long hair down on this unit, they will pull your hair out? That's the truth. So it's not on me. God grant me the serenity to accept the things I cannot change and the courage to change the things I can. All right. Let's take a 15-minute break and we'll come back. If you smoke, don't inhale. Moving on, question 9. The following are all emotional regulation skills that support a person suffering from ACEs or trauma to heal and calm their nervous system so they may move forward in their life. A, the pretzel, which crosses midline. B, butterfly tapping. C, breath work, which we haven't done yet. 4 square breathing and 4 extended exhales. We've done the 4 extended exhales. Resourcing positive memories and enhancing them with questions that strengthen brain and bodily positive response. Or E, all of the above. All of the above. Excellent. All right. So let's review the skills for a moment. The pretzel with breath work and extended exhale. So assume the pretzel. Let's see. If you're right-handed, it's right over left. If you're left-handed, left over right. Got it? And how many extended exhales? 4. 4 extended exhales. How long do we need to hold the posture? 2 minutes. Why are we holding it 2 minutes? This is how long it takes to reset the sympathetic nervous system, moving it from sympathetic, from the gas to the brake, to the parasympathetic. All right, butterfly tapping, what does that look like? And we begin that with 2 to 4 extended exhales as well. Do we start off really fast? No. We just start off, fairly slow. You can speed up or slow down, but if people are really doing this, we want to just a little more gently. And you laugh, but you know what? Some people don't even know they're doing this. That's the trauma response. And so with all these exercises, it's always important to remember to say, if you're comfortable, close your eyes. If not, look down and soften your gaze. Yes, it has a similar effect. Heart hug, right hand goes where? By the heart, under the left arm over the right, downward gentle pressure, squeeze or hug, deep breath in the nose, out through pursed lips. Hold this about 2 minutes as well. Sometimes if a client can't come up with a positive memory, just to slowly count to 120 will be very calming. That little boy in the emergency room said, I feel like I'm in a dream. He slowly counted to 120. I said to him, I think he was 7 or 8 years old. I said, can you count up to 120? He says, 1, 2. I thought, oh man, we're going to be here a while. And then it was all worth it because then he just calmly kept his arms up, and he went, I feel like I'm in a dream. That will be in my autobiography someday. I prayed for that child every day for a long time for his healing. So walking and bilaterally tapping, right? Pushing against the wall. EFT, karate chop point, where is it? There we go. With all my problems and all my limitations, I deeply, completely accept myself. Even though I got pulled over by the highway patrol and I owe a lot of money now, I deeply and completely accept myself. Even though my mother-in-law doesn't like my cranberry sauce, I deeply and completely accept myself. Even though it's death by PowerPoint today, I deeply and completely accept myself. So, and the under the collarbone point. So you find your collarbone. Halfway, collarbone runs from here to here, so about halfway in the middle, drop under it, go into the soft tissue. You can tap or massage that. With all my problems and all my limitations, I deeply and completely accept myself. You're going to do a round of how many? 3 on both points. All right. And so restorative movement, that's the bilateral restorative movement where we're tapping. And YouTube is full of this, folks, so don't panic. Just go Brain Gym Adults, Brain Gym Children. They give you all 26 exercises. Resourcing with a visual image or personal memory. We already did that, using all your senses, what made it so special. And so that's a review of our skills so far. All right, so prolonged exposure to trauma and stressful events may cause an individual's natural alarm system to no longer function or to overfunction, keeping their amygdala enlarged and living in the limbic, emotional brain. Prolonged exposure can create emotional and physical responses to stress that last long after the trauma. Prolonged exposure to trauma and stress result in emotional numbing and psychological avoidance. Prolonged exposure to trauma and stress can affect an individual's sense of safety and identity. Remember me saying my friend who woke up in the morning, she was a bunny rabbit in a world full of wolves. It can diminish an individual's capacity to trust others and their own judgment. All right, 4-7-8 breath. Andrew Weil made this popular in the United States. This is a yogic breath which is used to bring balance to right and left brain, stimulate the parasympathetic, rest and digest. We can do that together. So I'm going to say breathe in and I'll count to 4, hold for 7, breathe out for 8. If you have a chest tube right now and I can't see it, or you have high blood pressure, you do not want to hold your breath. If you have a normal blood pressure and you're fairly healthy and you haven't recently had a heart attack or any issues, you can do this with me. So in other words, most everybody in here should be fairly healthy. So breathe in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Breathe in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Breathe out, 2, 3, 4, 5, 6, 7, 8. Breathe in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Last round. Breathe in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8, and relax. That's 4-7-8. If you want to do it with Andrew Weil, Google that one on YouTube. He's glad to do it with you. He even gives you some other things to do, like putting the tip of your tongue on the back of your front teeth where the teeth run into your gum is a PowerPoint, not the kind that I'm showing you, but a point, a neurological point, which is very relaxing and calming. So it's on the exhale. All right.
How do you spell his last name?
W-E-I-L. He's at the University of Arizona Integrative Medicine Program. All right, so alternate nostril breathing. Again, this is just a good basic right-left brain stimulation. Who is it that's really big on this? I can see several different people. So you take these two fingers, put them in between your eyebrows. That's to scotch yourself. You're going to take your thumb, put on the right side of your nose. The other two fingers go on the other side of your nose. We're going to press the thumb against the right nostril. Exhale through the left. Breathe in through the left. Hold the left side. Exhale through the right. Breathe in through the right. Exhale through the left. Breathe in through the left. Exhale through the right. Inhale through the right. Exhale through the left. And relax. Lullaby and good night. Da, da, da. Yeah, how many of y'all feel chill now? All right. Somebody's stomach growling back there? I'm just kidding. I guess that's an engine outside or something. All right. So I forgot to say on the 4-7-8 breath, you did that for a round of 4 and no more. It has diminishing returns after 4. So research says just do 4 of the 4-7-8. Alternate nostril breathing, you can do it until you fall over backwards and go to sleep on your pillow. And 4-7-8 isn't necessarily making you sleepy. It's just relaxing you that much. A lot of nurses and doctors and staff, social workers that work 12-hour shifts, they will tell me after doing the pretzel, but it made me feel so tired. I can't do that and work. I went, it's because you're so tired that you feel tired. You are now in touch with it. So the pretzel neither energizes or makes you sleepy. It just relaxes you and resets you to your baseline. The more you practice these emotional regulation exercises, especially the pretzel, your baseline respiratory and cardiac is going to drop because you're not revving your engine up. You're not riding that sympathetic nervous system, waking up, drinking coffee, running around, doing all your stuff, eating lunch, swigging a big cold iced tea, getting off from work, running around picking up kids. 72 to 80 is, quote, the normal pulse rate. Mine is 52. And you're like, wow. And the other day when I did the pretzel and it was 96, it dropped to 46. That tells me how quickly resilient I am because of the hatha yoga I'm doing, the breath work and the meditation. So not bragging, it takes effort, but the effort's worth doing. 4.5 years ago, I almost died from sepsis. I want to tell you something. I was doing headstands before I went in the hospital and I almost died. So sometimes it doesn't matter how healthy you are if you're still stressed out. And I was working 312s and no longer could go back to that. So 4, 7, 8 breath, alternate nostril breathing. There's all kinds of, there's a great guy in a loincloth doing the tree on a rock somewhere in the Himalayas in front of a waterfall teaching breath work. I was like, check him out. That's what I want to do. Only I need a top too. So, but it's the stuff on YouTube is just fun, and it's like I want to look him up. And then the next YouTube video, if you got one, you get them all. The other guy was sitting there, was an American sitting in lotus with his arms like this, going, he's just pumping the breath. Have y'all seen any of those videos? I'm like, I'm not sure I can do that, but it looks fun. It looks energy producing. So going back to that phase 1 safety and stabilization, attention to their most basic needs. Are you hungry, angry, lonely, tired? Where have you heard that? 12-step rooms. Halt. Are you hungry, angry, lonely, tired? If so, pretzel up. Take a deep breath. Get a cup of hot liquid. Preferably without alcohol in it, because then it has another different effect. But hot tea.
I actually ran a group one time, and they actually wanted to add sick and stressed to the end.
Sick and stressed, yeah. So address those. Check them and stuff. Any of those that can be taken care of right now. One of the things, if I go into a room to do an assessment or supervise an assessment at Mission, and I see there's no water pitcher or water there for them to drink, the first thing I do is I go, I'd like to get you some water. Would you like some? Yes, I would. I go and get them some water. Think of what that communicates. I notice you don't have water. Water's really important, especially if you're detoxing from a substance. Because if you don't have liquids going in, you're getting more toxic by the moment. So, and I ask them if they're cold. If they're cold, I go get them a warm blanket out of the blanket warmer. A warm blanket and water. Can you think of anything else that's more basic than that? But it communicates volumes. So, and I model that for the staff that I supervise and work with, because they come in and they're just ready to do that assessment, where I'm walking in and I'm showing up and I'm looking at the environment. I looked over and I thought, wow, that's interesting. That guy didn't take his medication. So I've got to buzz the nurse and say, hi, I just want to check in with you about the medication right here. He may have been asleep when you brought it, or you may have forgotten it. Do you kind of see where I'm going? We don't leave medications laying out, because somebody could walk by going, there's my Ativan for the night, or whatever. So we're showing up in the environment. Showing up is a powerful 2 words, and looking to see how I can support, care, and reach out and create trust and attachment. Because remember, attachment is the root of all disease, I think, lack of. Focus on regulation of emotion and develop capacity to self-soothe before and during emotional highs and lows. If a person learns these skills before they're activated and their nervous system knows how to use it and they know how to use it, are they more likely to use it when they're activated? You darn tootin' they will. And I'll tell you, Michael Todd, one of my good buddies over at Mission, he's the director of Copestone on the behavioral health side. He said, Linda, he said, the day I walked into Copestone, one of the adult acute units, and I saw one patient teaching another the pretzel, He said, I knew we had found something really important. It was so helpful to one patient, they were teaching another. That's a magical moment. When he shared that, I teared up. I was like, oh my gosh, we're making a difference. So provide education on trauma and treatment process. Be a hope merchant. That's another client, not client, but social worker in the area. Oh God, I can't remember his name. He does great IFS work. He said, our job is to be a hope merchant. Who is that? He said at October Road. Oh, he's real tall, used to be the wine guy. Rob Campbell. Rob Campbell. Anybody knows Rob? He is a hope merchant. Has a private practice here in Asheville. Awesome guy. How have you gotten through difficult times in the past? Normalize their trauma. What do you say for them to encourage them and to support them and help them not be alone? So be a hope merchant. And
Give an example of normalizing trauma.
normalizing trauma is, what I hear you saying is that you grew up in a very violent home and your father was an alcoholic. And when I hear you say that, that communicates to me how difficult it might have been for you. Can you help me understand what it was like for you growing up? Is that helpful? Because if I'm doing an assessment or they share with me my father was an alcoholic and beat the shirt out of me, then I want to normalize that. I want to validate. I want to support them that, wow, you had a violent father. How did you get this? How did you get through that? How did you survive that? Many people grow up in violent homes, and obviously you've survived it. How did you do that? How did you, did you ever do trauma work around that? Yes, I did when I was in treatment at ADAC. How'd you stay sober during that? Or how did you stay sober when your father died, the man who abused you so badly? So it's like asking open-ended questions and just validating their experience. There's nobody in this room that's not had trauma. So it's about getting in touch and doing our own trauma work. All right, if you remember nothing else from today, here it is. Peter Levine. He said a few years ago, trauma is not what happens to you. Wait a minute. Don't look at that. Trauma, he said, because he has two parts. Here, there you go. Trauma is not who you are, it's what happens to you. Now you hear the difference between I'm broken, I'm bad, I'm wrong, I've got trauma, and thus I'm a bad person. Trauma is not who you are, it's what happened to you. We can work with you to help get that off of you, release that from you. Then Peter Levine came out, and I hope I'm correct. I hope I'm not going to get sued. Trauma is not just what, no, wait a minute. Trauma is not just, trauma, I'll get out in a minute. It's on the board, now I can move. It's what happened or happened to you without an empathic witness. So trauma is not just what happened to you, it's what happened to you without an empathic witness. Nobody there to help you get through it. Nobody to help you make sense out of it, work through it, help you get safe. Does that make sense? So trauma is not just what happens to you, it's what happens to you when you don't have anybody to help you through it. Now, if what many of us have experienced, if we had somebody to help us through it, we would have had probably less stored trauma, and it wouldn't be haunting us today. But we need somebody to help us through it. You, as a caring, non-judgmental, trauma-informed staff with a bunch of doggone good skills now, may become an empathic witness for your client or patient to escort them, to support them through that trauma. If nothing else but listening and supporting and referring them out to a trauma treatment specialist, and or teaching them any of these skills that you're learning today, the pretzel and tapping, butterfly tapping being the first two. If that's all you taught, it would blow your mind. Hell, they'll come back and say, I taught my child that, and now they, instead of having a tantrum, they tap it down. I taught my husband that. I taught, I taught it to a 16-year-old, she was 14. She was 14. Her mom came with her to therapy. She stayed for a while, and then mom went off and had her coffee and left me with the teenager. And they were on the way to the beach, and they had a flat tire, just she and her mom. And her mom called me on the speakerphone and said, I just had to call you. We just had a major trauma. It's, dark where we are, and I had a flat tire. I'd never changed a tire in my life. And some sweet man stopped and changed the tire for me. We're back in the car, and I was still flustered. And my daughter said, for God's sakes, Mama, pull over and pretzel up. Isn't that great? Her daughter knew what would fix her. So once you learn this and experience it yourself, you want to share it. So I hope that you will, and your clients will as well. So Sharon Wise says this, trauma, there's nothing wrong with you, it's what happened to you. There's nothing wrong with you, it's what happened to you. So phase 2, processing and grieving of traumatic memories. The primary goal of this phase of treatment is to have the patient acknowledge, experience, and normalize the emotions and cognitions associated with the trauma at a pace that's safe and manageable. This is typically where your level 1 of trauma treatment is to manage the nervous system. That's emotional regulation. Level 2, CBT, cognitive behavioral therapy such as ACT, mindfulness training, DBT, rational emotive behavioral therapy. What else am I missing? Seeking safety, trauma and substance abuse treatment. So that's CBT is the next level. Then the next level up is your actual somatic work, and your work like EMDR, trauma resiliency models, sensory psychomotor, somatic experiencing. Does that make sense? That you're going to establish rapport and relationship and healthy attachment and trust and work our way from helping them regulate their own emotions and feeling safe in their own container, their own body. Then we're going to move up to that CBT, understanding what trauma is and how to impact it from a cognitive place. And then they'll be ready to move up to EMDR. And just like when I treat trauma, if a person can't close their eyes, I'm not going to say close your eyes and hold these TheraTappers and we're going to process through this using trauma resiliency model or another natural flow EMDR, because they're going to wig out. They can't close their eyes. So I might start with, again, matching the intervention with the level of activation. I might start with open eye EMDR, where we're using bilateral eye movements to take down the emotional activation, to where then they might be able to close their eyes and use the bilateral tactile stimulation such as the TheraTappers. So again, we sometimes have to scaffold that treatment to meet the needs of the individual and their level of activation. In brain spotting, one of the things that we do is we find the trauma stored in the brain by using the visual field. Now, and we also keep them stable by listening to bilateral music while they're finding where that trauma is in their visual field. If a person gets overactivated, there's one simple thing to do at that point. Look away from that point where their trauma is in their brain, that's in their visual field. If they just look away from it, it stops it. Isn't that incredible? And there's a technique that if they start feeling flooded or overwhelmed, they can keep looking at that point, then look beyond that point out the window, calm their nervous system, and then come back to the trauma point in the visual field and let it process out. Then if they get overactivated, look away. Do you hear what I'm doing? Bilateral again, movement. So there's many ways in all these techniques to keep a person safe and grounded while they release the trauma from their body and their brain. All right. Y'all are looking like wilted lilies out there. So, and it's only 3 o'clock. Maybe we'll get another break in here in about 30 minutes. Does that sound good? Stand up, do some Bastrika or something. So we're treating the trauma. So many people, when they start hearing a trauma story, what do? Don't tell me that. Right? Do you experience that? Like, oh my God, they're going into their trauma story. I got to manage this. And so they shut them down. You're sharing a lot about your trauma, and we really don't want you to do that right now. You know, they start panicking. And let me tell you, when somebody is telling their trauma story, look at you and you're panicking, what's going to happen to them? You're not helping the situation. So you want to stay grounded, take a deep breath and say, I want to stop you just a second. It seems like you might be going into talking about the trauma you had growing up. And I really want to know more about that and to help you get treatment. Right now, during your assessment, my concern is if you get into that, you may be upset or not have a way to contain that when you leave in an hour and a half, whatever, or the next 30 minutes. So if you're all right with this, I want to make a note of that. And when you're ready and your therapist is ready, let's get you referred out or your trauma treated here at October Road or RHA or wherever. Does that make sense? The main thing is really know that you're in control because you can stop them lovingly and appropriately. I had a nurse who almost died in labor and delivery. The problem is she was a labor and delivery nurse, which meant going back to work was very difficult. She got referred to me, and she insisted on telling me her trauma story of almost dying and her child almost dying and her hemorrhaging to death. So I said, okay, if you're willing to tap like this while you tell your story, and I'm going to tap too, because I don't want to take your story home with me. As much as I want to help you with it, if I listen to it in depth to the point which I know you will tell me, and I used to work in labor and delivery and was a nurse, you and I are going to sync up, and I'll be taking your trauma home with me, and I want to keep us both clean. She says, yes, I'll do it, and I'll tap. And she tapped, and she told her whole story, and I tapped, which made me like Teflon. It kept me from internalizing it. So remember, butterfly tapping while a person is telling you their trauma story makes you like Teflon. It won't stick because you're not like, this. You're holding your breath, you're tensed up, and you're soaking it up like a dish rag. You're letting it roll off of you, and you're acknowledging. So she did that, and at the end she said, oh my gosh, I didn't cry. I've never told that story that I didn't just fall apart. What made the difference? Bilateral tapping. Kept her grounded and calm while she told her story. It kept it from sticking to me. And then we launched Open Eye EMDR and then moved to somatic experiencing. Not somatic experiencing, but natural flow EMDR. With the TheraTappers, first 2 sessions, I'll tell you real quick, went pretty well, had good results, and then boom, it was like hitting a wall. That night when I meditated, I sat there and I prayed. I said, Lord, throw me a bone here. This woman is locked up. You got to show me what's wrong. I don't know how to help her. And nothing came. And I was very disappointed. And then I laid down on the pillow and closed my eyes and had a visual of her body's energy spinning the wrong way, counterclockwise. And immediately I knew from my EFT training that she had a polarity reversal. So you can look up polarity reversal in EFT or just straight up polarity reversal. And there's 2 methods for treating it. And I just said, oh, thank you, Spirit, whatever you are. Thank you, thank you, thank you. Called the woman. I said, I want to see you today if you've got the time. Saw her, did the 2 techniques. She practiced them at home. 2 more sessions. She's completely done. 4 sessions to release that level of trauma. That's it. That's powerful neuroscience. So, and also a reminder, if you run into a brick wall with your patient, pray, read, ask for help, journal, ask coworkers, just don't stop. Because some people would have given up on her and go, well, I'd really like to help you, but it seems like your trauma is in a place that I don't know how to help you. And then where would she have gone? She may not have had it treated and she never would have gotten back to work. And this was her career, labor and delivery nurse. So, yes.
Facilitating a group.
Mm-hmm.
And
Facilitate
a group, and someone sharing a trauma story that may be hard on the whole group, as well as you as facilitator. How do you, what do you do?
I'm not going to give you the answer. Who wants to answer that before I answer it? What do you do when somebody in a group's sharing their trauma story? You're a facilitator. You're in control of that group. You're the orchestra director. What do you do?
I have said, I have suggested that I say I would really like to hear more about this, and can we talk about this one-on-one so others in the group, may not feel upset, or I don't remember exactly, but try to get them to talk to me.
Yeah, talk to me individually. Yeah, so I'm thinking. Were you going to share? I had a question. Okay, so we're going to grab that. So one of the things I hear, maybe, tell me if I'm wrong, of what comes up when we're a counselor or social worker and we're in group therapy and somebody launches that trauma story is, oh my God, this is going south, everybody's getting activated, I may be. And yeah, no, we're all going to experience that. It's not just you. Even me, with a lot of experience, I'm like, oh, shirt. Oh, fork. Here we go.
I had that type of situation.
Oh, good, share.
I wasn't facilitating the group, but the group was, there was another counselor was facilitating the group, and they were watching video, like something from YouTube, and it was on forgiveness. And the man in the TED Talk was sharing his story. And it's activated somebody's trauma, one man, and he just uncontrollably started crying, screaming, and they didn't know what to do, and I was in my office, so they called me and said, can you do something? We need to do something. And I've been taking your training before.
Thank you.
So, so I ran.
I didn't pay him.
She didn't. I ran there, and we just kind of, with the nurses, we removed that person, brought him to my office. He couldn't sit down. He couldn't do anything. And I took, of course, my first response was like, I started panicking because I'm like, what am I doing?
Your mirror neurons kicked in.
Exactly, yeah. But I immediately, the first thing I started doing, I said, first I made a mistake. I put my hand on his shoulder, and it's kind of triggered even more. And I'm like, oh my goodness, what am I going to do? And then I said, well, listen, can you tell me what you see on this wall? And he just like keep bawling, and he's like, oh, I see the picture. And I was basically did the whole, that grounding exercise, 5, 4, 3, 2, 1, yes. And I did the whole thing, and at the end, as soon as he completed, he was able actually to sit down, he stopped crying, and he was able actually to talk.
Process.
Yeah. Yes.
Excellent. Give him a hand. Tell me your first name. Dimitri. That Dimitri, even though he did something that it didn't work, didn't know what to do, felt activate himself, did he give up? No, because he couldn't. He's the one that's responsible. He remembered 5, 4, 3, 2, 1. He said, tell me what you see on the wall. And the guy finally pulled it together, said what do you see on the wall? Well, 4 things you feel, 3 things. And then he was able to get grounded and in the moment. Very powerful, thank you. So we keep trying until we match their level of activation with the skill. And let me just go back and pick up on what you shared. Tell me your first name. Jenny. What we feel is we don't want to hurt their feelings. Well, I'm going to use an I statement, not a we feel statement. I'm breaking my own rules. What I feel is I don't want to hurt their feelings. I don't want to cut them off. I want them to feel supported. I want this to be a therapeutic moment. How do I do that? So I might say, Jenny, if I can stop you just a second, you've shared a lot, and I hear you getting into talking about or telling about what happened when you were growing up, and that's really important for you and me and everybody in this room. My concern is if it triggers anybody, so if you're willing, would you work on that with me in individual work, or let's create a container or a group that can bring forth that kind of story and support you and use some skills like bilateral tapping if you're going to tell it, and us do that with you. Would you be willing to talk about that and us prepare for it next time or work on it in individual work? Yes. All right. How did that feel, Jenny? And I want to check in with you, Jenny, because I stopped you, and sometimes that can feel like a cutoff. Where are you with that right now?
Yeah, I recognize that maybe it was saying too much.
Well, and I wouldn't say too much. You're sharing your story, and that's what group therapy's for. I just want to make sure that you don't get over-triggered or other people in the room and we get a hot mess, because You know, I'll be honest with you, Jenny, in teaching, and I teach counselors and social workers continuing ed, I used to share my trauma story of sepsis until I got feedback that it triggered people. And I had to stop doing that. I thought it was helpful because I pulled in some of the skills I used during my hospitalization. But for many people, one woman said, my mother died from sepsis. And when you said that, it ripped me up inside. Another person said, my father died from, it was everybody dying from sepsis. And I went, oh crap. And then I got into my guilt thing because 85% of the people who had sepsis at Mission that year that I had it died, and I got to live. So if there's any doubt why I'm alive, it's because some greater spirit bigger than all of me kept me alive. And I even got to see the black sky with the stars in the tunnel and the white lights. And I'm here to breathe and live and meet my full creative potential. So I don't tell trauma stories anymore, Jenny, because I just traumatize other people. Now, if somebody wanted to ask me about my personal experience with sepsis and my hospitalization, I would be glad to meet with them one-on-one. So you kind of hear where I'm coming from, very transparent, very immediate, really checking in with them to make sure that they're not feeling cut off and getting them to bring that to the larger group and creating a container for that. Because her story is her story and she's ready to tell it, and we want to provide the therapeutic moment for that. Yes, where's my hoogie?
So we have rules, and one of the rules is don't tell a yes. Yes, and one of them is don't tell war stories or traumatic stories. So having like a rules and having that, saying that at the beginning of the group could help.
Mm-hmm. And reserving the right to stop the group if somebody begins telling a war story about their drug or a trauma story that maybe the whole group's not quite ready to hear. Very good, thank you.
So my question is sort of related. So, and I know like referring out, but because I am a peer support, I'm working towards my CSAC, my CSAC-I, but how do I know like how far I can go?
Well, that's the question that I don't always have the answer for. So as a CSAC, you wouldn't want to treat trauma. You could teach emotional regulation skills. I recommend that, which is, again, helping people manage their trauma. And you can use seeking safety and other curriculum that CSACs can use. But to say I'm going to treat your trauma and then start utilizing other techniques such as EMDR or trauma-resistant smile, any of the somatic treatments you wouldn't want to do until you had a clinical degree such as a master's and you have training and it's within your scope of practice. So scope of practice is the key piece there.
So what if somebody's just telling you a story? Like if you're...
Well, if you're comfortable hearing it and you feel safe about it and you know that person and you talk with them about the importance of tapping, and they've learned the pretzel and some things to modulate, you may choose to do that. Cherokee, Lisa, you want to share a little bit about ashes to beauty to ashes or ashes to beauty? Is there anything? It can be a peer model, right? And where they're telling their narrative of their trauma and they're circling up as a community group. So in various cultures, is it? Beauty for Ashes. If you want to Google that, Beauty for Ashes. There's various communities that, especially indigenous cultural communities, that have narrative therapy groups where they tell their trauma story and a container is created by those community members. Just like they did at Charles George VA hospital here when that doctor circled them all up and they told their trauma stories and began to work through them. Or they did it through prose, verbal and written. All right, any other questions for you? Excellent questions and comments. Yes, Margie. Oh, thank God y'all are all in one little hub.
There are something I use are called touch points, and you can go online to touchpoints.com, and they are bracelets, or they fit in little wristbands, and they buzz. They're like the tappers, but the person just can wear them while they're telling the story. So I often use those before I even get to EMDR, even maybe when they first come in or after I get to know them a little better, I said, would you be interested in giving these a try? And so it's doing the tapping without them having to tap on themselves while they're telling their story. Or
So they have on each wrist, so it's
and
bilateral?
it's bilateral. They sing
Cool.
it. It's called
All right.
touchpoints.com.
All right. And touchpoints.com has not contributed anyway to this training today. All right. So treating trauma is a little bit of a slippery slope. So we need to know when and how to treat it, how to build that scaffolding from emotional regulation to CBT to actual somatic work. All right, and practicing within your scope. So we want to start with self-soothing again, and this slide just talks about everything that I just talked about. Phase 3, reconnection, development of affirm, or a new sense of self, development of healthy and supportive friendships, intimacy, and spirituality. One of the most powerful ways to reconnect in the community and reintegrate is through 12-step work. And if a person is an addict or alcoholic or abuses substances, because it is a fellowship, it's a community experience, it's a self-help, it doesn't cost anything. And we have smart recovery, which is ecumenical. You don't have to believe in God or any of the other spiritual kind of stuff. And there's many self-help groups right now in Asheville, which are people who are have mental illness who are getting off of their medications. And it's a huge support group right now. I don't remember the name of it, where they're supporting one another to contact the physicians who are willing to assist them with getting off their medications. And you can, if you are wondering how difficult that is, just if you're on a medication and you're mentally ill, try asking your doctor to take you off of it and watch what happens. You know, and opiates are the same way. So that reconnection and reintegration. Yes.
There's also Asheville Dharma. They used to be Refuge Recovery, so they're based on Zen Buddhism, which is also a sober support group. And then for anybody that doesn't know DBT, I'm not certified, but there is a website called dbtselfhelp.com, and it's a group of people that put this up online, so it's got all the lessons with their observations and the homework assignments, and so people can go out and actually do that themselves.
Yeah. And there's Radical DBT out of California, and that's all I'll say about that, but it's pretty incredible what they're doing. All right, so lots of self-help out there. So reconnection, identify current and future support network, ask the patient, who are you closest to right now, who's most supportive of you, how might they help you or help you get back into the community, help you find a job, help you find housing. Are there any people in your life that you'd like to get help from? If so, who is that? Even if it's just agency staff. Have you, and you know, where I hear a lot of that is AHOPE. AHOPE is the only family that some of our homeless folks have. Have you attended any support groups like AA, NA, Celebrate Recovery, NAMI, National Association of Mental Illness? They have parent groups and client groups. Outpatient mental health groups, church or spiritual support. Sunrise Community. And we got anybody here from Sunrise? Yes.
I'm on the board.
You're on the board at Sunrise. Would you say just a couple words about Sunrise as a peer support program?
It's an amazing organization. It's Sunrise.
Oh, wait a minute. Whoa. Forgot.
Sunrise Community for Wellness and Recovery. I always get recovery and wellness confused. It offers a Blair House Respite Center for a week for people who need respite, just someplace to help them not go into the hospital. They provide all sorts of wraparound services. I think we have up to 15 staff people now, almost all peer support specialists, and just offer all sorts of groups. And I encourage you to just go on their website and check out all the things that they offer. Yeah.
A minister associated with that, or is that a separate org?
Mark Seiler for the Church of Holy Chaos. There, he's on our board. Yeah.
All right. So yeah, he has been offering a lot of services to folks in the Asheville community. I've heard a lot of good things about him. All right, protective factors. So as we're identifying trauma, the protective factors describe how they survived that trauma. There are behaviors, characteristics, and qualities inherent in some personalities that will assist in recovery after exposure to a traumatic event. These are called protective factors. And so when you're using the opposite of the ACEs test, you're doing a protective factors questionnaire after ACEs to help them see how they survived it. Somebody said, how did you survive growing up in a violent family? I'd say, because my grandparents lived next door. My mother believed in Girl Scouts, so I went to Girl Scouts once a week. And so what happened is, though I experienced violence at home, I had safe places to go and safe adults to be with. So use of self-soothing skills, supportive family communities, spiritual faith and support, access to clean food, shelter and water, access to building supplies and seeds after a disaster, self-help groups such as AA, NA, Al-Anon, medical and mental health care. You know, after Hurricane Katrina and the hurricane that was, it wasn't the Bahamas, it was south of Bahamas somewhere. What was it? What? Oh, no, further back. It was huge. It leveled the whole island. Haiti. That the people who stayed and salvaged what was there had less trauma than the people who were removed from the island. The people who were able to stay in New Orleans or surrounding area after Katrina had less trauma because they could stay there and look for the dog they couldn't find. They could go, when the waters receded, they could salvage what they could from their house. You kind of hear what I'm saying? It's like sometimes we think we're doing them a great favor by rescuing them, and we are, and some have to be removed inland. But for those who can stay and salvage and share what they've got and bring in seeds and hoes and things that they can recover their lives, have less trauma than those who are removed. That makes sense. All right, grounding. Yes, Dimitri introduced grounding a while ago at 5, 4, 3, 2, 1. So we'll do that right now. So tell me quietly, but out loud, 5 things you see in the room right now. Go ahead. The light, Dimitri, John, Phil, and flowers. 4 things you feel with your body. The chair, my arms, the floor, my legs. All right. 3 things you hear. The PowerPoint, your voices, the buzzing lights. 2 things you smell, and if you don't smell anything, what are 2 of your very favorite smells? Lavender and fresh rhododendron in the air. All right, and 1 thing you taste, and if you don't taste anything, what's your favorite taste? Fresh freaking baked bread. And more bread. And more bread. I made olive bread this weekend to die for. Yeah, there's a cookbook, to bake bread is to live. All right, guided grounding. So if you're comfortable, close your eyes. If not, look down and soften your gaze. And do not panic, because all of this is on your handout. Feel your feet touching the floor. Press your feet into the floor. Imagine what your feet look like inside your shoes. Wiggle your toes. Imagine what your toes look like as you wiggle them. And take a deep breath and notice your breath. Feel your legs against the chair. Feel your hands touching your lap or another hand or the chair. And notice your breath. Feel your back against the chair. Squeeze your shoulders together and gently drop them. Squeeze your shoulders again towards your ears and gently drop them. And notice your breath. Move or massage your neck. You can even use your fingertips to massage your neck. And notice your breath. Squeeze your arms using your hands. Massage and squeeze your upper arms, giving your upper arms a little squeeze and massage. Squeeze your lower arms, giving them a little massage. Take a deep breath in your nose and blow out through pursed lips. Squeeze your thighs, massage your thighs. And another deep breath in the nose and out through pursed lips. And when you're ready, open your eyes and return to the here and now. That's guided grounding. Feel good? Yeah. All right. All right, so we're going to watch something that's going to make us feel really good about ourselves. I forgot how I discovered this a few weeks ago, but I've sent it to everybody I know, and now you will be tortured as well. Because it will so open your heart. It's incredible. So, Maya Angelou, Love Liberates. So there's several of these, so if you like it, you can watch several of them. But let's see if I can find the right one. No. How many minutes? 2 minutes? No, 5 minutes. Is that it? No, maybe. Let's see. Nope, that's not it. Starts halfway. Dadgummit. Where's? Nope. Why do they always want to start at halfway? Give me the original one. 2, 3, 150, 3, 20. Oh my gosh, don't tell me they've taken it off. Replay, is this? Okay. 1 second. John, be patient with me. This is that good. No. Oh, okay. Oh, yeah, here we go. Well, doggone, I'm glad they got the police out there. They need to police somebody else, though.
She told me, sister, when you get, give.
No. That's worth silence. Love liberates. So there's several of those, and she goes on to tell the story of her growing up and having a child, a son, and leaving home, and what her mother and grandmother said and that kind of thing, and it's even more powerful. So I did not know that she did not speak for 6 years of her life. And so hearing that and understanding, she didn't speak because of trauma. And I don't know if her trauma was treated by somatic experiencing or trauma resiliency model or by none of the newfangled neuroscience techniques of somatic treatment. But something happened to change her and to make her feel safe and make her utilize her full creative potential as a woman, as a teacher, as a mother. And what a powerful, powerful teacher she is. If you get, give. If you learn, teach. And that's why I'm here today. I feel like I've got something to share. And I appreciate you guys being open and receptive to that. If I offend somebody, I'm sorry, but also too bad. And no, humor is also something that I really deeply believe in. I, as a kid, used to read Laughter's the Best Medicine in Reader's Digest because those were safe pages where I could laugh. But when we hear somebody very powerfully share their story, we don't want to cut it off if it's safe to share it. I mean, you hear what she shared and where she is right now in her life. And of course, she passed away just a couple years ago. And she lived and died her last years in Winston-Salem. Actually taught at Wake Forest University. And what a great thing for her to land there. There's another documentary about Nina Simone. She was an African-American woman. If you've not watched that, it covers her trauma, domestic violence, trauma growing up, domestic violence, and her whole life. And another moving story that just reminds me, if the right people are in our lives and the lives of those who have had trauma, severe or not as severe, trauma is what happens to us without an empathic witness. And we can be that empathic witness today for those clients. So I'll share that. And I hope you'll share that Love Liberates with a lot of your friends because it's been really powerful for me and a great way to connect to different people. So we'll cover this and maybe take a 5-minute break and then we'll finish up. We only have like 10 slides left, and the last few, there's a few more skills. Behaviors that increase resiliency. One thing we want to learn about. Matthew Walker, jot his name down, Matthew Walker. Why we sleep? Is that it? Yes. Matthew Walker, Why We Sleep. Sleeping at least a good 8 hours, quality sleep, cutting caffeine off at 1 o'clock in the afternoon. Sleeping where it's dark and it's cool are the two pillars of good deep sleep. Deep sleep is the most rejuvenating, healing thing that we can do for our brains and bodies. So good self-care. Get off the freaking phones, get off the computer, or get yourself some blue lenses that do y'all see my lenses today? The purple flashing? I have them. When I went in, I said, give me those things that block that blue light because I'm on the computer quite a bit writing. Yes?
He actually posits that should be the number one diagnostic for any healthcare provider, is to assess for sleep.
Yeah, assess for sleep. How are you sleeping? Yeah. Yeah, you know, a lot of people say, how are you sleeping? How are you eating? How are you defecating? Are you exercising? How are you moving? That there's several general questions that will instantly capture a person's well-being. But there's a great PDF by Matthew Walker about the pillars for foundational pillars for sleep. I'm getting ready to present at Mission in a couple weeks on sleep, lunch and learn. That's what I love about Mission. I can just say, I'm going to do a lunch and learn, and all these people show up, and I get to share with them all this new technology, all this stuff about how to keep ourselves healthy. To people who work 12-hour shifts. 3 days on, 4 days off. They don't sleep. All right, eating nutritious foods. I don't know if y'all been in the grocery store lately, but don't touch the end caps. That's where all the junk food is. They're wanting you to buy them. Forks Over Knives is a great documentary. Food Inc. I'll talk about nutrition and eating good, healthy foods. Exercise, especially with friends. You know, I hit 61 and all of a sudden I'm like, I feel like a slug. I do yoga, but I wasn't getting aerobics in. So 2 months ago, I went and bought sneakers. Didn't know a thing about sneakers. Got my sneakers. Started walking. I could not run. I could run a few feet, but felt like, oh gosh. Now I run to the mailbox and back 4 times. Yay me. And I'm like, okay, I'll go ahead and show you. These pants used to fit. They're big now. And that reminds me that I was that sedentary, because what does a counselor do all day? We sit. So by George, I'm exercising. And the neighbors, I see all my neighbors now. And we stop and we talk and we wave, and I've got 6 rescue dogs, and I don't leash any of them. I'll go, let's go for a run. And they all hit the door barking, and they run behind me all the way to the mailbox and all the way back 4 times. And all my neighbors are like, there goes that crazy gray-headed lady, that counselor, with her daggum rescues. I mean, you know. I put a red bandana on every other one so that they don't get hit. So, practicing healthy boundaries in relationships, using positive coping mechanisms versus negative coping mechanisms. In other words, instead of getting up and drinking coffee tomorrow morning, go outside and do Bastrika. Notice how you feel different. Notice you won't crash after lunch. Using self-soothing as opposed to substance use or risky behaviors. You know, many people, Friday, they can't wait to get home to have that glass of wine. And which is fine for some people, other people not so much, but it will interrupt your sleep. And so if you're not getting good sleep and you're drinking wine Friday night, what happens if you drink wine or a mixed drink on Saturday? You're not sleeping throughout the weekend in a way that you could that's rejuvenating. There is a great book out I'm going to present. I wake up in the middle of the night and I go, oh, I want to teach that. Isn't that crazy? And I write it down. Women and Addiction. There's a great book called Wine O'Clock. I believe that's it. W-I-N-E O'Clock. And it's the phenomena of women and wine and how they start drinking when they're cooking dinner until they go to bed, and how that's interrupting their sleep, destroying their health, aging them, and causing all kinds of health problems. And the 2 books I would say about alcohol right now is the best one, and I'd say get on audiobook, is Alcohol Lied to Me. I can't think of his name, but he's Australian. Craig Beck. Absolutely. If you get on audiobook, he will leave you in stitches. It's very informative, but he tells good stories and funny ones. And then the other one is Alcohol Explained. Both of those are really powerful books. One is more science-based, one's less science-based, but Alcohol Lied to Me is his personal experience of getting sober from being a wineaholic. And he really covers that well and tells great stories. That everybody I've seen 6 alcoholics, 6, let me back up, not necessarily alcoholics, 6 people with alcohol abuse disorder since I started back to work January 2nd. 6. So the holidays triggered 6 people into treatment. All 6 are still sober as of last Thursday and Friday. So it's like people are waking up. It's not a moral issue, it's your health. And when it starts affecting your health and affecting your job, and most all of them, it was wine. So I want to teach on wine and the seductiveness. And you think Big Pharma's got some advertising power. You look at the alcohol industry, you can't get out of bed in the morning without planning what you're going to drink today, because I got the idea, for, you know, it's the commercial. Dun, da, da, dum, bum, ba, da, dum, bum, ba. When I do that song, what do y'all think about? Andre Cold Duck. Made that was a Christmas song long before Andre Cold Duck made it a commercial. Bing, ba, da, dum, dum, da, da. You know, it's like, oh my God, it makes you want to go out and drink Andre Cold Duck, right? That's what it's supposed to do. No, thank you. I don't drink cold duck. All right. All right, let me put my little thingy back in. All right, we're almost at the end. Resilient survivors continue, therefore, to grow and even thrive in spite of, quite often, because of their history. So people thrive and survive despite their history of trauma. Survivors of trauma who strengthen their abilities find wisdom that allows them to grow emotionally in relationship with others and are often referred to as experiencing post-traumatic growth. Post-traumatic growth is reflected in the following: strengthening relationships, a sense of connection, developing a fellowship, increased sense of personal strength, feeling like you have personal agency and personal value, and that you can make a difference in the world. Awareness of increased possibilities and potential in your life. So here's something that I want to say, and Chris will agree with me, I know. The journey we are on is the journey of waking up to our full human potential as enlightened, loving, compassionate beings. This is the journey of enlightenment, the journey of waking up to all of our possible potential. And many things that trauma is to our brain and body puts the brakes on that. So as much as we're able to get our trauma treated, use these skills, get off our phones. Okay, so I have to be careful saying this story, but I'm going to shift it a little bit so the parties won't be calling me tonight saying, "You told my story." Okay, so this person, young man, said to me, "I'm dating a woman now, and I really enjoy her company, and I feel like I'm falling in love." And I went, "What? Tell me more." "She never takes our cell phone out when we're together." Did y'all hear that? We walk, we hike, we sit at dinner, we talk, and neither one of us touches our cell phone. I started to pull mine out when I realized, oh my goodness, she's not pulled her cell phone out. I shouldn't pull mine. Is that powerful? They neither touch their cell phone the whole time they're on the date. Imagine that. And what's the first thing you guys see when you walk in a restaurant right now?
Two people on the phone.
Two people on the phone.
Sitting down for lunch or dinner. And
They're both on their phone. And how about their kids?
On the phone.
On the phone. Yesterday I was at Telco because my credit card got hacked and I got to go in and get another one. And I'm sitting in the chair waiting for my new credit card. And this girl said, "This is taking forever. I know I should have brought my phone in." I turned and looked at her and I said, "Please don't go get it. Savor the moment." Well, you know what? She said, "Okay, my name is Regina and I'm a counselor." I said, "Me too, but my name's not Regina, it's Linda, and where do you work?" And the next thing you know, we struck up a conversation, we exchanged cards. What happened? Connection. Isn't that the sense of connection right there in Telco? And she said, "Did your card get hacked too?" And I went, "Yes." And she said, "Oh my gosh, did it not like scare you to death that all your money was gone?" I said, "Yes." We shared trauma. There's nothing like, you get a call in the middle of the night that says, "Did you authorize these expenditures or whatever?" Press 1 for yes, 3 for no. I'm like, fork, no, 3. Energy drinks and workout gear down in Florida? No. All right. So we talked, and did we talk about this at lunch? And how did we feel when we all talked about it? Connection. All right. Review of skills. All right. So real quick, pretzel, how long do you hold it?
2 minutes.
And 4 what? 4 extended exhales. Bilateral stimulation. How long are you going to do it?
2 minutes.
2 minutes or till their problem disappears or they regulate. Heart hug. What does it look like? Yes. And you can add a pillow to that or a weighted blanket and make it even more powerful. Because if you put a pillow there, I have 2 feather pillows in my office that people use. And when they put it, don't I, Dawn? And Dawn comes to my office and we hang out and smoke cigarettes and drink beer. Just kidding. Anyway, no, I'm not. Yes, I am. Way to go. Because when you put that there and they do a heart hug, or you're doing any kind of therapy, it gives them a shield, a layer, a place of comfort. So walking or pushing against the wall, gentle restorative movement, what does that look like? You can even do that in the bed, right? You can do it in a chair, but you can't do it standing on your head. Oh, and they say you can't. All right. Resourcing with pleasant or neutral people or places. You know about resourcing. 4, 7, 8. How many breaths can you do before diminishing returns? 4. Alternate nostril breathing. Parking your 2 fingers here. EFT, show me the karate chop point. All right, show me the under collarbone point. And what are you going to say? With all my problems and all my limitations, I deeply and completely accept myself. And you guys, when you start saying that in your sleep, think of me. Grounding, 5, 4, 3, 2, 1, grounding imagery of getting to feel your feet on the floor, your legs on the chair. You know, if they're laying on the floor, feel the floor underneath you. Imagine what's under the floor. Imagine the dirt. Imagine the earth. Imagine the water that's stored under the ground and the earth. You guys can wing this, right? Yeah. All right. It's reference time, which means what? We're at the end. Yay! Give yourselves a hand. All right, so 2 or 3 of you, what can you take with you? And the faster you do this, the faster we leave. So what are you going to take with you? Pretzel. Who else? What are you going to take with you?
Butterfly while they're talking.
Butterfly while they're talking. Makes you like Teflon. What else?
Make a card for my clients with the picture.
Yeah, some resourcing cards, nice pictures. Yes, even laminate or not, or just have them in a basket right there. What else?
When you learn, teach.
What you learn, teach. Share it. One more.
Love liberates.
Love liberates. Amen. Om Namah Shivaya. It means the spirit, my spirit bows to the life and all that is, but especially in you. So thanks for making this day work, for sharing, for teaching, and I hope to see you back here or out in Leicester for a training sometime. All right. Bye, guys. Thank you.